Hi students, welcome to chapter 13. This is going to be skin, hair, and nails. So we're going to relate the anatomic structure of the skin with its function. We're also going to cite examples of healthcare implications presented by alteration in the skin. We're also going to incorporate health promotional concepts when performing assessment on the hair, the skin, and the nails. The nurse is assessing a patient who's been admitted for liver failure. So what findings would the nurse expect? Would it be cyanosis, flushing, rubor, or jaundice? So liver failure, what would we expect the patient's skin to look like? And the answer for that is jaundice, number 4. So think of the skin generally as the largest organ in our body. Covers almost everything. Um, how else do we utilize our skin? Well, if you say for protection, you would be correct. If you say for identification, that would. So there are two layers in our skin. We have the upper layer, which is the epidermis. The dermis is below that. And then you have the subcutaneous tissue beneath that as well. So the adipose fat is beneath those two layers. And this slide gives us a chance as to exactly what that looks like. So we see that most of the appendages are actually in the dermis itself, the second layer of the skin. And then beneath that, those yellow globules that you see are the adipose tissue. Now, we think about our hair follicles, like our sebaceous glands. Those are located in the dermal area. And those sebaceous glands, of course, they open up to in the hair shaft itself. We also have melanocytes that are located within that area, and of course that gives us our pigment to our skin. We have eccrine gland that is also there as well. And of course, that is the sweat gland that actually opens up onto the surface of the skin itself. Now think about a patient that, say, has sustained a burn down to the dermal layer of the skin, right? So if we think about the appendage, the hair appendage is found, the root of that in the dermal layer. So if a patient sustains a burn, then what we will not see when that area is healed is we won't see any hair to that area. Why? Because the hair follicle is gone, and so hair will not grow from that site at all. Um, the erector pili muscle is also located in that dermal area, and that is that muscle that actually contracts when we are cold. It causes our hair to stand on end, right? That gives us goosebumps, is what we call those. So those are generally located within the dermal area of the skin. Let's move on. So now we look at the nail itself. We can see that a few things we can see when we look at the nail. We can see the color of the nail. We can see any markings on the nail itself. We can see where the nail meets the tip of the finger or the midsection of the finger right at the cuticle. The nail matrix is actually located underneath that cuticle area. And sometimes we have people biting their nails and biting at their cuticle. They can actually destroy the matrix. And then we'll end up with a divots in our fingers and also potential for infection as well. Now, the nail plate is generally clear. And so what we're seeing underneath is actually the blood supply, or those blood vessels that are located that actually gives us the color. Now, you normally see in a lighter skin tone, the nail bed looks a little bit pink. In a darker skin tone, you may not see pinkness. There can actually be a darkened area that you see under there, under the bed of the nail itself. But it's not saying that the person is cyanotic. It's just because you're seeing just a darker coloring underneath the nail bed. We can look at the nail sideways, and we can actually look for clubbing, and that is the angle of the nail when we view it on the lateral view itself. We can also check circulation, but this is not just viewing it. We'd have to do something else, which would be palpating the nail in order to do that. So the function of the skin. Why do we need our skin? So if I took off the skin off my face and I put it on your face, who would I be? Would I be me or would I be you? Quite interesting, isn't it? There was an old movie called Face Off. I don't know, you guys may be too young to have seen it, but they just switch their faces, right? And so we're not quite sure who's who. However, so we use our skin basically for identification, right? Think about your fingerprint. It's the skin that actually has those markings that makes it individual. My fingerprint is different from your fingerprint. We also need our skin for protection from the environment, right? If our skin integrity is intact, that means we don't have any cuts or openings in our skin, then it's protecting stuff from the environment coming into the skin and protecting what's inside from going out. Temperature regulation actually occurs on our skin as well. We are able to sweat and actually cool our skin down. And for communication, think about some of us, when we communicate, we use our facial features to communicate. You smile, your face contorts and moves wide outward to give that communication that you're smiling, or if you're angry, do we see that on the face? And then absorption and excretion, again, sweating occurs. We can absorb things through our skin, like medication if we put on it. And also, it's important for production of vitamin D, right? I can just walk out to the sun, just hang out in the sun for a good 10 minutes or so, and then the process of creating vitamin D occurs with sunlight going through the skin itself. And our skin is also waterproof, right? If we walk out in the rain, we won't melt, and the rain won't get through our skin. So our skin has multiple functions, some addition on there as well. Now, our skin shades are quite different. Um, all of us has the same amount of melanin within our skin. Um, well, all of us have the same amount of melanocyte, okay, which is a precursor for melanin, but we have different amounts of melanin in our skin. So some of us are lighter skin tone and some of us are darker as well. Skin tone also comes from some other properties as well, such as hormone levels. We think about a woman who's pregnant, and sometimes we see her face takes on a darker mask. We call that the pregnancy mask. And of course, genetics play a role as well. And of course, if we go out in the sun, it may make our skin a little bit darker than if we have not seen the sun for days and days, right? When we look at our hair as well, we can see that there are some differences in our hair texture and the quality of our hair, the length of our hair, much different between the African American hair versus the Caucasian hair, and also the person that's maybe Indian, the hair texture is a little bit different as well. On our skin, we can also see things like keloids, and there are some individuals that are more prone to keloids. And what keloids are, they're just an overgrowth of skin that occurs. If there's injury, the skin proliferates and it tries to heal itself, but then it continues to grow. And so those are called keloids. On our skin, we can also see what we call a butterfly rash. Those patients that actually are diagnosed with lupus, one of the ways that they diagnose the patient is by determining that they actually have this sort of butterfly marking on their face. And so we can diagnose that person with lupus. So With pregnancy, a few things you may also see on the patient's skin. If you look on the patient's abdomen, you'll see a nice dark line going straight up midline on the patient's abdomen. We call that linea nigra, and it's just a darker line due to hormone levels on the belly. We also see on the face again the darker color on the face. It takes on a sort of a darker hue that's called chloasma. And sometimes when the skin is stretched, we can actually see striations on the skin. Think about like a basketball player or maybe a football player sometimes where their skin grows because of the muscle that they're actually putting on. And you can see those lines. Maybe it looks a little bit purple and then it changes to like silver color. That's striae on the skin. Um, when an individual gets a little bit older, there are some things that we can actually see on the skin of the older adult, like liver spots. We call them senile latinges, but liver spot is a colloquial term on the arm, especially the backs of the hands, those areas that have been exposed to the sun a lot. If we smoke, especially if we do this for years, it'll actually cause our skin color to become a little bit more yellow, appears a little bit more leathery, or leathery, and then also we see more wrinkles and coarser wrinkles on the patient's face. So, just a word to the wise, if you want to look young and beautiful, don't smoke, because then your skin won't change as much. And then with the older person, their skin gets a little bit more thin. Sometimes if you like go into an acute care setting, maybe even a nursing home, and you look at an older person's skin, you see how paper thin their skin is. And that's simply because over time, we lose the elasticity in our skin and also the the adipose tissue or the subcutaneous layer, that level of adipose tissue is reduced as well. So there's not a lot of cushioning under there. It makes the skin looks a little bit more flat instead of plump. Now with infants, what we can see on their skin, if you've ever seen a newborn baby, what does the skin look like? What's on the skin? You'll see a cheesy kind of white, yellowish kind of substance on the skin that's called vernix caseosa. And that vernix basically is a combination of like sebaceous gland production, sort of oily production that is on that skin for protection of the infant. Their newborn skin is not as mature as the older adult, and so the environment we have to protect them from, because it'll be easier for substances to get absorbed through their skin. So the vernix is protective for the babies. We usually, actually, when a baby's born, bathe the baby and then give the baby to mom, washing off all that vernix. But research now tells us that that vernix is very protective. Instead of making the skin dry, it keeps the skin moist. And so we just clean off the face, generally wipe the vernix off, and then cover the baby and hand the baby to mom. So as you guys start going to clinicals, and if you see a brand new baby, make sure you don't touch the baby with your hands, just without gloves. So be sure to wear gloves here as well. Now the baby's hair, you can see some like fine hair on the baby all over the baby's skin. This is called lanugo. And then on the baby's head, we do have like terminal hair. Sometimes it's not what the hair is going to look like as the child grows a little bit older. The consistency, the texture will change a little bit, but it is basically a terminal hair. That's what we have on our head as well. Now in children, on the skin, the epidermis gets a little bit thicker. So as we age, our skin, of course, gets a little bit thicker, and it becomes a little bit darker. So an example would be if you look at an African American baby that's just born, you may notice that that infant skin is lighter, and then over the next few weeks or so, that child's skin takes on a darker appearance to what their true coloring would be. But one thing is, if you actually look at that baby's ear, the baby's ear will actually have the color skin that that infant will eventually keep. And then in puberty, some of the things we can see on our face would be, if you've ever seen a teenage face, you'd see acne on the face, right? Yeah, because this would basically be sort of a overproduction of oil or sebum. It becomes a little bit more active during the teenage years, and so you may see acne on the face. You may also, at this point, see, especially for guys, you'd see facial hair developing, the males as well. And then both girls and boys, you'll see hair under the axilla and on the pubic area. So these are some changes that occurs to the skin as we go through the developmental phases. Now, when we are asking questions about either the skin hair or nails, what is some information that you'd like to know? How about if there's been a problem with the skin, any kind of complaints? How about if you've had a rash, possibly? So some people have psoriasis that we can see on the skin, maybe eczema, right? Maybe someone has allergies. If you've ever been gardening and sometimes touched the wrong trees or bushes out there, you know, you can come in with, right, some things on your skin. You find out that you're allergic to certain things in your garden. Changes in the pigmentation or color, some disease actually cause changes to the patient's skin itself. That maybe Addison's disease will change the coloring of the skin, makes the skin a little bit more bronze color. And skins sometimes have like moles on the skin, and those can actually possibly change in shape or size, right? Size or coloring as well. And on the skin, we assess for moisture of the skin. Let's just think about a diabetic patient who maybe the blood sugar is really low, and then the patient starts experiencing some changes. We could feel the wetness on the skin. We call this diaphoresis. Or maybe they have problems with their thyroid gland, and so it makes the skin kind of maybe dry or velvety soft. So these are things that we can actually see on the skin. You can ask about these things. Maybe a person easily bruised on their skin. Maybe they've been taking medication like anticoagulants that could cause bruising on the skin. So we ask about medications that they may be taking. And how about hair loss? We know people have gone through like alopecia, right? Um, and then behaviors. If you look around these days, maybe even on yourself, you may see like tattoos on the individual, right? So these are behaviors that occur that actually changes what the skin looks like. So additional things that you would ask for infants and children would be things like birthmarks. Now, an African American or the darker skin tone child, you may actually see Mongolian spots on the baby, and this would be a darker mark on the Caucasian infant. The Caucasian infant may have a lighter kind of a coffee with cream kind of appearance on it. It's yellow, more yellow in the middle. We call that cafe a lot, those spots. And if a person have a problem with the liver function, you may actually see the coloring of their skin a little bit off. So it'll appear a little bit yellow. It's jaundice. And this is related to the breakdown of the red blood cells that we're actually seeing. A person's skin can also appear bluish in color. This would be considered cyanotic or cyanosis. You can see that around the lips, etc. You can see it in the oral mucosa, especially on the darker skin toned individual. So we ask about rashes or sores on the baby. You may see diaper rash on the child, and then bruising on the child, especially if we're assessing for maybe abuse on the child's skin. And you'd ask about other disorders. You can see scabies. We think about homeless patients. I used to work in a homeless shelter, and you can just see the track mark of the scabies infection on their skin, like the webs of their fingers going up their arms, etc. If a person has lice, you may actually see that on the individual individual as well, generally on the hair, the shaft of the hair. And we assess the hair for lice in generally school-age children. Some other things that you can see would be like measles or chicken pox, etc., on the person's skin. So there's quite a bit of information that you'd be actually asking your patient or your client about. There are individuals that are actually allergic to the sun as well. They can't stay in the sun too long because they may break out. So those are questions that we'd be asking. Now, of course, you'd ask about some protection in order to do some education with your patient. Um, and especially for the teenager, you would be inquiring about how do they treat the acne that's on their faces, so either blackheads or whiteheads, etc. And just think about other things that you would ask, especially for the older adult with their skin, right? Would you ask about bruising on their skin for them to give you that information, and then how they take care of their skin? Now, sometimes we can see erythema on the skin as well. This is an example of a patient who's had an IV in the arm, and for whatever reason, maybe it was gloves that wasn't as clean as it should be, or maybe we touched the insertion site with our finger for whatever reason. Here is erythema because we now have appears to be the start of an infection at the patient's IV site. So we want to be sure that when we're caring for such devices, that we actually take precaution. We do not want to give the patient an infection um, either on skin that's broken, or if we actually perform some intervention with the patient. Okay, so we don't want phlebitis to be the issue with when we care for a patient's IV site. When we look at the hair, we want to look at the color of the hair. So what does the hair look like? Normally, there should be, unless the person is older, you should see the pigmentation of the hair. So the hair is, for my hair, probably darker in color, maybe black. And of course, don't look too hard, but I am graying around the edges. And so as I age, I'm actually losing the color of the hair itself. And this is what happens to older patients. So the color is lost from the hair itself. So you look at the color of the hair, you look at the texture of the hair. The hair texture generally should be soft. Now, depending, there are different levels of softness. Um, the softness in my hair, African American hair, of course, I am locked, so it's a little bit different. But the softness in my hair naturally would be a little bit different than the softness, say, from a Asian person. The softness is a little bit different in feel, but the hair should be really soft. If a person colors their hair a lot, then it takes that softness, it changes sort of the texture somewhat. Um, Although they're using, different products these days that makes it a little bit different, but generally takes away some of the sheen from the hair as well. And then look at the distribution. If you're talking about a person who's getting a little bit older, like a man, you could see that he's maybe losing the hair. So we have male pattern baldness occurring, or some disorders where people, lose their hair called alopecia. So we're looking for that as well. And when we look at the nails, we're looking at the shape of the nails and the contour of the nails. So remember I said that you can actually look at the nails from the profile sign. Yeah, you can just put the nail up so you can see it sideways in front of you. And what you're looking at is you're actually looking for the nail itself and what the shape of the nail looks like. Generally, the nail, and there's a good picture in your book actually of what the nail looks like. You can actually see clubbing of the nail if you go to page 211. You can see clubbing of the nail, and that would be the second picture in the middle. And how we really know objectively that there's clubbing is that we're looking at the angle where the nail actually meets the cuticle. It should be about 160 degrees. When clubbing is beginning, then it starts to flatten out. a little bit, and then that would give us about 180 degrees because of clubbing. Now, some nails are sort of flat, some nails are sort of curved, and not because a person have a curved nail mean that they actually have clubbing. They don't. I think at the end of my talk, there's an example of what a nail with clubbing actually looks like. But I thought in your book there was a picture of a nail that actually is clubbed. There's somewhere in the picture. Um, but at the end, oh, actually it's on page 242 where you see late clubbing. That's what the nail would actually look like. So of course you're also going to look at capillary refill as well that we can assess on the nail. And what it is for you just to depress the nail, push down really hard for like 2 to 3 seconds, release it, and then you're watching to see how quickly the blood return comes back to the nail. It should take 1 to 2 seconds, no more. So it should be brisk. And this gives us information as to the person's circulation. So cardiac system we can find out as well. So when we actually view the nail, we're getting sort of respiratory information. Is it pink or is it cyanotic, right? But if we palpate it by pressing down and doing capillary refill, we actually can get information on circulation as well. And that should be really brisk, not sluggish. Now, on the skin itself, we can actually see some wounds on the skin, and we actually we grade these wounds as to the type of wound that it is. So we can see some ulcers versus excoriation on the skin, right? So excoriation generally is the skin is really not completely broken. We haven't lost like the top layer, the epidermal layer of the skin. So maybe it's just a little bit reddened. And then ulcers, we actually stage the ulcers on a patient's wound. So ulcers are generally where there's a skin break, and pressure ulcers are generally wounds that occur over a pressure point or a bony point. So we stage them, stage 1, 2, 3, and 4. And then, of course, if we cannot see the wound bed, then that would be an unstageable wound itself. So a stage 1 generally would be a wound where the skin is not broken, but if you press on it, it doesn't blanch in color. If I press on my skin right now and release, the skin can't change color, like the blood is gone from it, and then once I release, the blood flow comes right back to it. Stage 2 would be sort of like an abrasion of the skin. The top layer is gone. Stage 3 would be now it's down to actually the muscle. You can see the muscle. Stage 4 would be you can see other things underneath like bones as well. Okay. Okay, so sorry about that just a moment ago where I was all over the place. So some abnormal findings that you may see would be for an infant, you could see dermatitis, diaper dermatitis, which is that infant sitting in urine or stool for too long, and so it starts to break the skin down. So here we would do some education with mom or the provider. It doesn't have to be mom, whomever, mom, dad, or the babysitter. They need to know how to care for the skin properly to get, the urine or the stool off the patient's skin. So soap and mild soap and water will help with that. And then we have some barrier skin cream that would help that as well. So you may also see impetigo on the person's skin as well, which is what you are seeing in the lower picture. Maybe you can see eczema on the skin. We don't often see measles these days, but actually, if I'm not mistaken, a year or so ago, there was an outbreak of measles in the United States. And then German measles you can see on the skin as well. And chicken pox you can see on the patient's skin. So these are just pictures of additional things. Patient that is reacting to medication, like the top picture on the right, is actually an allergic reaction to medication. One medication like vancomycin, if we give it too quickly on the in the IV, the patient can actually break out in what we call red man syndrome, and we definitely don't want to do that. So it's very important for you to know exactly how fast to give medication and what you are giving. We can actually create problems in our patients if we don't know and we do the wrong thing. Ringworm is what you can see as well. That's on this young lady's cheek on the right. And then psoriasis, you can see on patient's skin. Again, cold sores or herpes simplex, we can sometimes see, right? When we start stressing, you can see breakout of cold sores on the face, generally around the lips. And then herpes zoster or shingles, we can see generally shingles only occur on a single side of the body. It doesn't really cross the dermatome. You can see on the patient skin itself. So um, we can look and we can see Kaposi, which is a purplish kind of lesion in a person's mouth. We can see hirsutism, which would be hair on a woman's face. You know, so there are different things. And your book has excellent abnormal findings, so I'm not going to actually take the time to go over all of these. But cradle cap, you can see, and this is a picture of this. So seborrheic dermatitis, and this can actually happen to babies. Babies have these, and it's because the sebaceous gland is basically overproducing. And you know, you see these little almost like sores or scabs develop on the individuals, the little babies. So that would be a picture of what late clubbing actually looks like. Um, and for a person who chronic problem with poor oxygenation is what that would look like. So here is a question for you. Herpes zoster or shingles is characterized by 1, a bacterial cause, 2, lesion on only one side of the body, it does not cross midline, 3, absence of pain or edema, or 4, postular umbilicated lesion. So if you were listening a few minutes ago, I actually gave you the answer. So the answer is 2, the lesion only on one side of the body does not cross midline. And the next slide will show you what that looks like. So that's a picture of what herpes or shingles would look like. And it is very, very painful for patients who actually have shingles. So hopefully you had chickenpox when you were young. So this last slide basically has some hissy hints. So on the nails itself, we can see that the nail can be pink. If we squeeze the nail, we can actually feel it when there's clubbing that it's spongy. It should be soft, but it really shouldn't be like a sponge. And then we can see cyanosis on the nail if we see it nice and blue. Hair color, we know how to assess the hair for color, what it feels like, um, whether it's shiny or it's dull, etc. Um, on the baby's skin, we can actually see a little bit of yellow color on the baby's skin sometimes when they start eating real foods. And that is because they're reacting to the carrots in the food. And if you stop giving the baby the carrots to eat, their baby food, then their skin will actually come back the other color, their normal color. So, but it's called carotenemia. And what we would do is just ask the provider or the caretaker what the baby had, say, the last 24, 48 hours. When we are assessing the skin of a darker skin tone person, we have to be sure that most of what we can see, say in a Caucasian skin, on the skin itself, we have to go in the oral cavity for the darker skin tone person. So if I'm looking for cyanosis, the best place to see that is actually in the mouth, the oral cavity of the darker skin tone person. Jaundice, I can see it there as well. So how we palpate body temperature when we're checking temperature on the skin, we can feel temperature. We check it with the back of our hands, right? Remember how your mom checked your temperature when you were a baby? They put the back of their hand on your forehead. So we can check temperature that way on the skin. And as you're doing your assessment, hopefully when you're checking out the temperature of the skin, I'm seeing you use the back of your hands, right? If we do eye movement, and that is coming up in another lecture, we want to be sure that we're using what we have available to us, that would be our fingers. And pupillary response, generally, we'll talk about that as well, but we'll address perla, and that, of course, it'll be brisk reaction. And I think this is the end of my presentation, so thank you for listening to chapter 13.